Primary care is important because it is a way of thinking about the patient such that you don't separate him or her from the life that they're living.
Being able to be that frontline advocate for patients, not just for their medical needs, but for everything else that's going on in their life, is to me the most exciting thing about primary care.
The Center for Primary Care sponsors a number of educational and experiential learning opportunities for students, one of which is the Student Leadership Committee.
The purpose of the Student Leadership Committee is to give primary care a voice within the student body at HMS.
So primary care is at a turning point right now. There's so much opportunity and there's so much change necessary, and we really need people with fresh ideas and fresh eyes looking at these problems. So it's a tremendous opportunity, especially for medical students, to get involved in these projects.
My favorite project with the Student Leadership Committee was putting together a symposium on mass incarceration and health.
I've been working with a Primary Care Innovations Fellow at Chelsea Community Health Center on a project that looks at disparities in lung cancer screening.
There are grants, the Agent of Change grant, the Innovation Fellows grant, that bring people together with a pot of money which they can use to implement exciting innovation projects. There's the Student Clinic, the Crimson Care Collaborative, which more than half the student body is involved in. And there's the Poussin Scholars Program for students before they even enter Harvard Medical School to get excited about community medicine and addressing healthcare disparities. The Center for Primary Care funds research projects and master's degrees for students interested in taking another year.
The Student Leadership Committee is a very, very diverse group of people.
It's people who are interested in health systems. It's people who are interested in pediatrics or geriatrics or working with families. It's people who are interested in social justice.
It's an incredible responsibility for students to get together and say, this is how we want to learn, this is what we want to learn, this is how we want to fill the gaps of what we think should be taught related to primary care in medical school.
Primary care has never been so strong at Harvard as it is in the past 5 or 10 years. Having students who advocate for primary care, in addition to the clinicians and the professors who have always advocated for primary care, gives us just more strength, more of a voice, more of a positive image amongst the student body.
It's bringing together people for these conversations, it's building awareness and then taking action on it, and leaving our community and our school better than when we got here.